Of the 2,500 New Jersey residents who have contracted AIDS, more than 60% have died. New Jersey has the 5th largest AIDS population in the country, and the problem is going to get worse. This week, senior correspondent Larry Stupnagle will be examining the problem of AIDS here in New Jersey. The disease knows no social boundaries, and the ethical and economic questions it poses indicate that we are all living with AIDS. Larry begins his report tonight with a look at IV drug abusers, and we should warn you, some of the initial pictures are explicit.
This bitch, she don't want to act right here.
This is how most of the AIDS cases in New Jersey start. People who shoot heroin or other drugs make up nearly half of the 2,500 adolescents and adults who have developed AIDS since 1981.
This is where the majority of the people come over here. Hi, fellas.
For the last 3 years, Ron Austin of Spectrum Healthcare in Jersey City has gone into the shooting galleries of Hudson County. A former drug user, he has already convinced 400 abusers to come in for help. He also tells them not to share their needles and to clean them in a mixture of water and bleach to try to kill the AIDS virus.
I mean, things like not to touch the bottom with the spike, you know, because you might scratch off some germs or something.
Austin says there is an AIDS awareness in the shooting galleries, and it has given addicts an incentive to try to clean up their lives.
They looking at all these people that that peer group that they used to be involved with, who was shooting drugs with them and they died. You know what I mean? All these people, I mean, a lot of people died in this area.
More will also likely die as a result of AIDS. Many of New Jersey's addicts are already carrying the virus and don't know it. That's because it can stay in the body for months or years before attacking the immune system. Based on the known number of cases today, the health department predicts there will be over 10,000 New Jerseyans with AIDS in 1991.
That's probably about 1 out of every 75 people in New Jersey. And that is assuming there's no more transmission tomorrow. Just with that number of people infected, we will have 1 new case of AIDS every 3 hours in 1991.
30-year-old Jennifer, which is not her real name, had injected drugs for almost 10 years. She got help, kicked her habit, but was told during rehabilitation that she tested positive for carrying the AIDS virus.
It was impending doom. I thought I was going to die and die in that place I was in. And I had feelings of complete despair, you know. At least I was in the right place, though. I had a lot of counselors, a lot of support around me. And I was able to deal with my, my feelings of grief.
By continuing with counseling, Jennifer's outlook on life has improved because she has met others who have carried the AIDS virus for 6 or 7 years without developing symptoms.
I can just see where I was and where I'm going. It's real good for me to have the therapy, and I suggest anybody who tests positive go for therapy.
She now takes life one day at a time and says carrying the AIDS virus has helped her to stay off of drugs. But being a carrier means making some hard personal decisions about her boyfriend and having children.
I really do love him dearly, and I would rather him be free and happy than with me and get sick. So if he's willing to stay with me and we take precautions and be, you know, happy each way we can with each other, then that's important too, if he's willing to do that. And I can't have children. That upsets me a lot. I can't have any children right now. Right now. Today I can't. Not that that's what I had planned on doing, but I'm 30 years old now, and I would really like to have children someday.
Jennifer has just started a new job and says she feels good about her future. Ron Austin reports that the 2 men we saw at the beginning of this story have entered a drug treatment program. If you or someone you know has AIDS or tested positive for carrying the virus, there are 2 numbers you can call for help. The first is the New Jersey AIDS Hotline. Its number is 1-800-624-2377. That's 1-800-624-2377. The other is the Hyacinth Foundation. Their number is 1-800-433-0254. That's 1-800-433-0254. Tomorrow night, we'll look at the problem of children with AIDS.
But I'm the good luck, Jersey. Prime example of a typical chick. My booty's kinda thick, so you know I'm pulling numbers quick. Look but don't touch, no need to rush. We could get together if we kept it on the hush hush. I won't tell if you won't tell. Nowadays you gotta keep it on the hush hush tip.
I won't tell if you won't tell. Nowadays you gotta keep it on the hush hush.
If he doesn't know, how can it hurt? My man should've known from the jump that I'm a chick known to flirt. Why do you think I got the name Entice? Why do you think all the fellas be looking twice? I am what I am, and that's a fly chick. People compare me to Rick because I'm so slick. Now check it out. I was coolin' with my girlfriends, walking by mad guys, getting more whistles than a whirlwind. Yeah, that's what we was hearing. Walk a little closer, baby, as we were staring at this one and that one. I spotted this fly kid. It was my man's best friend staring weak in his eyelid. Yo, I must admit that I was shocked. I mean, my man's best friend sneaking up on my job. Could I get caught? I think my chances was slim. I mean, yo, what's my man got to do with him? I won't tell if you won't tell. Nowadays, you gotta keep it on the hush hush tip.
I won't tell if you won't tell. Nowadays you gotta keep it on the hush hush.
No rings on my finger, so I'm cheating. Coolin' with my man's best friend out, trick or freaking. Who would've thought that your best friend would sneak behind your back every week with your girl in the sack? I'm not dumb. I knew it was the plan of my man to test me, to see if I would kick it with his friend. But I'm a tough act to follow. When it comes to running games, call me Chicago. Matter of fact, there ain't a brother that can hang. Did not you know that Entice is my name? You tried to play me like a Genesis. Now it's time for me to step forth. I gotta put an end to this. I can have my cake and eat it too, but you both get the boot, huh? I'm looking for someone new. You got played, now you want me to keep it on the hush hush. Another one bites the dust. I won't tell if you won't tell. Nowadays you gotta keep it on the hush hush tip. I won't tell if you won't tell.
Nowadays you gotta keep it on the hush hush. Let the dog. We out, cow.
Sneaking behind his back, sneaking behind his back. Sneaking behind his back, sneaking behind his back.
Children with AIDS. Only one state, New York, has more of them than New Jersey. Tonight, in his series of reports on living with AIDS, senior correspondent Larry Stupnagel looks at the growing number who are being born with the tragic disease. And we'll meet a Newark woman who has opened her heart and her home to these children.
2-year-old Cynthia has lived every day of her short life with AIDS. Her mother was an intravenous drug user who contracted the disease and gave it to Cynthia during her pregnancy. Her foster mother, Jean Gibbons, was already taking care of Cynthia's 5-year-old sister, Crystal, who does not have the disease, when she was asked to take Cynthia by the state. She did not find out until she got Cynthia home that the child had AIDS.
She was real puny when I first got her. I would start out to take her when I first saw her in the hospital because she was real sickly looking. But once I got her home, then, started caring for her. It didn't make a difference. It was, by that time I had already grown attached to her.
Gibbons believes in keeping families together. That is why she took in Cynthia's twin 9-month-old little sisters, who were both born with the disease. This was after she had lost a 14-month-old foster child to AIDS last November.
It was bad. In fact, I didn't have the twins yet, and I had said to everyone, I said, that's it, I'm not taking any more children with AIDS, But then, when they come to you and say they have twins here, we don't know where to put them. What can I say? I can't say no.
According to the health department, Cynthia is one of 76 youngsters in the state who have developed AIDS since 1981. 2/3 of them have died. Most of the cases were the result of drug abuse or a mother who was infected by having sex with a man who has AIDS. The others were from infected blood products that occurred prior to the AIDS blood screening in mid-1985. The problem is going to get worse. Dr. James Oleski of Children's Hospital in Newark predicts that by 1991, there will be 600 children with AIDS in the Newark area alone.
It's almost impossible to think of those numbers because with the present facilities, the present staffing, I don't know how we're going to respond to those kind of numbers.
Oleski has been treating children with AIDS for 5 years. He tells prospective foster parents home care is best for the youngster and safe for them.
A child doesn't give an adult AIDS, a child doesn't give another child AIDS. You get AIDS by having sex with people or searing dirty needles. So we can reassure people that they can safely take a child with AIDS into their home, give it love and care, and with very simple precautions, things that they can do, common sense hygiene things, take care of that child safely and not put themselves at risk.
You cannot contract AIDS through casual contact or just touching. Little Cynthia here is very lucky. She's found a home. Too many other kids like her cannot get one.
That's why the Division of Youth and Family Services and the Health Department funded the St. Clair's Home for AIDS Children in Elizabeth. Love and care are provided here for youngsters who might otherwise only know a hospital during their life. DIFAS has asked for an additional $2 million in state funds to open similar homes in Essex, Hudson, and Atlantic counties.
How much mommy love you? What's that? Oh, bunch. Oh, bunch.
Givens has been honored for her work, but her biggest reward came last week when she adopted Cynthia and Crystal.
Everybody's, asking me why. I don't think I'm doing that much to make a big deal out of. I really don't. But I think it's just the matter of you have to care for people. The big thing is you have to care. If you don't care for children, then you forget about it. You have to care for children.
The Division of Youth and Family Services gives additional financial and medical support to foster parents of children with AIDS. If you would like to open your heart and your home to a child with AIDS, call the Human Services Hotline at 1-800-222-0047. That's 1-800-222-0047. Tomorrow night, we'll meet a Plainfield man who lives every day with AIDS. Ken.
Beautiful story about love. Larry, thank you. There is a mental as well as physical toll extracted on someone who has AIDS. Often the problem is made worse by people who treat those with AIDS as today's lepers, untouchable and unwanted. Tonight, in Part 3 of his special report, Living with AIDS, senior correspondent Larry Stoopnagel introduces us to a Plainfield man who is not only fighting the disease, but the discrimination that accompanies it.
39-year-old Tony Lopalato lives every day with the physical and mental stress of AIDS.
I don't feel contaminated, and I don't feel like I'm worthless. I just feel like there's no future.
Tony was told last year that he has AIDS. He has been hospitalized 3 times because of the disease. To cope with the stress, he sees his psychologist, Dr. Margaret Nichols, every week at the Hyacinth Foundation in New Brunswick.
Seeing everyone get sick, cyclically, however, is a big reinforcer to me that it's just really a matter of time, that it's not going to be 2 years or so.
One of the things that concerns me, not just about you, but about anybody with AIDS, is the impact of seeing other people with AIDS get sick around them. Do you know what I'm saying? It's like, when that happens, you can't help but focus on it. It can't help but frighten you, and it can't help but demoralize you.
Tony is gay. Gay and bisexual men are the second largest group of people with AIDS in New Jersey. He found out he had AIDS after his life partner, a Frenchman named Jean, died.
I brought him to the hospital. Once we had gone back to France, I brought him to the hospital, and I stayed on a cot in the hospital bed next to him for about 3 weeks until he had a major seizure which rendered him brain dead.
Because of the stigma attached to AIDS, Jean's parents sent Tony away so they could say their son died of meningitis. Tony talks freely of his sexuality and having the disease. His mother worries about him, and she says she lost some of her friends when they found out about Tony's illness.
Some of the people thought that I was ashamed, and they were afraid to face me. So I made them know that there's nothing to be ashamed of. He's my son.
Although AIDS is not transmitted through casual contact, there are those who will not be in the same room with Tony once they know he has AIDS.
It makes me sick to think that people can think that way about another human being? They never met me. How do they know they don't want to be in the same room with me? What the hell's the matter with them?
You become a walking symbol of death, and that's what it is. And it stirs up everybody's deepest fears about death and their own mortality. And most people at our age just haven't dealt with that, period. They just haven't dealt with it.
But AIDS is something that Tony and his family deal with every day.
It's like you're afraid if the phone rings and somebody's going to tell you that, you know, he's very sick again. As long as he's on the upswing, it's okay. I can cope with it. But I'm just afraid if anything happens, if it goes down, you know.
It's not always easy. I think that's why I haven't been sleeping really well the past week or so, because as much as I try to push it out of my mind, it's there.
There are support groups for people with AIDS and their families at different locations in the state. If you would like more information about the groups, you can call the New Jersey AIDS hotline at 1-800-624-2377. That's 1-800-624-2377. The Hyacinth Foundation in New Brunswick also has a hotline. Its number is 1-800-433-0254. That's 1-800-433-0254. Tony Lopalato was recently readmitted to the hospital, and tomorrow night we'll visit him there and confront some of the medical issues in a society that is living with AIDS. Phil?
An East Rutherford man suffering from AIDS claims an ambulance refused to take him to a hospital, refused because of his disease. Doctors described the man as seriously ill at the time. It's a growing problem for AIDS patients, healthcare professionals who won't care for them. When they do get care, it's expensive, and within 2 years, they're dead. Senior correspondent Larry Stupnagel looks into all this in tonight's installment of his special series, Living with AIDS.
3 times this year, Tony Lopalato has been hospitalized with AIDS-related conditions. This last visit was for PCP pneumonia, a lung infection found primarily in AIDS patients.
I started running very low-grade fevers and felt generally tired and not particularly well, run down. And the fevers persisted. I had night sweats. And then started with a persistent dry cough.
During the 3 stages of AIDS, the patient goes from the human immunodeficiency virus infection, where no symptoms may show up for years, to the AIDS-related complex or ARC stage with its chronic swollen glands and weight loss. When the acquired immunodeficiency syndrome or AIDS stage sets in, the person's immune system is so weakened that they are vulnerable to opportunistic infections and certain cancers. Death usually occurs within 2 years.
I try not to think about it too much. But every time I get sick with something, it sort of undermines my psyche a little bit. It makes me feel more vulnerable. But I'm not falling apart. Not yet.
But at hospitals like St. Michael's in Newark, physicians who care for AIDS patients are tired because there are not enough doctors for the growing caseload.
And we're almost all alone in this, with patients that invariably have a fatal outcome. We all have burnout. There is an infectious disease man in this country that isn't burned out.
Still
100.
Okay.
Tony says his medical care has improved since his first hospitalization last winter. His mother remembers his initial care.
Well, it was bad. When I went there, his food was behind the door in the hall, and they wouldn't bring it in. Whoever came brought it in. Either it was us or his friends, and by that time it was awful. I came out and saw the doctor, and he came out and hollered at the nurses. He said, if you can't do the work, get off the floor.
That sentiment is echoed by Dr. James Oleski of Children's Hospital in Newark.
If someone went into medicine, they went into medicine to take care of people. They have absolutely no right or privilege to say they're not going to take care of an illness or a group of people. If they have that attitude, they should get out of medicine and do something else.
But there are reports that some healthcare professionals and doctors are refusing to treat AIDS patients. Specialty hospitals with physicians who exclusively treat people with AIDS are being considered to alleviate the problem. But how to pay for New Jersey's projected 1991 $500 million medical bill for AIDS has not been resolved.
It's not just a public health problem, it's a social problem of whether this should be borne through our hospital uncompensated care system, through state revenues, through private charity. But all I can say is I think it's going to swamp almost any source that we can think of. No one source is going to be adequate for the size of the burden that we face.
Tony is back home. While he was hospitalized, his mother visited almost every day.
I have a friend who's a nurse in a hospital, and she's taking care of 8 patients. She said that some of them die because their parents don't care. Nothing seems to help them because they don't have anybody supporting them. And I think that they should support their children. They didn't ask to be born. They should take care of them.
To help take care of the mental stress of AIDS, there are support groups for AIDS patients and their families. If you would like more information about these groups, you can call the New Jersey AIDS hotline at 1-800-624-2377. That's 1-800-624-2377. The Hyacinth Foundation in New Brunswick also has a hotline. Its number is 1-800-433-0254. That's 1-800-433-0254. Tomorrow night, we'll look at what the schools are teaching youngsters about AIDS and the search for medicines to stop the AIDS virus. Ken?
Thank you, Larry.
Health experts believe education is needed to slow the spread of AIDS until a vaccine for it can be found. Tonight, senior correspondent Larry Stoopnagel concludes his special series, Living with AIDS, by focusing on efforts to teach New Jersey's youngsters about AIDS while the pharmaceutical industry looks for ways to stop it.
Today, we're going to put our emphasis on AIDS.
This year, for the first time, AIDS has been added to the family life curriculum at Bayonne High School.
Who is at risk, okay? Sexual intercourse, definitely, because we said it is a blood-borne virus.
Using in part a suggested lesson plan from the State Health Department, teachers tell the teenagers how AIDS can be sexually transmitted. Students are advised that condoms can reduce the risk of getting AIDS, but abstinence is the best protection.
Even if a person has one encounter, and it can be the first encounter, but if it's with the wrong person, that person has contracted AIDS, yes. The bubble has burst.
The kids are also told to say no to drugs.
When people share needles, there always is a little bit of blood left. And then when the next person uses it, they will get the germs that were in my body.
The school superintendent believes the high school is AIDS-free.
Our main goal this year is to assure that they have accurate information, that they are in a position to deal with the disease.
Some students have already made up their minds about sex and AIDS.
I just don't have any sex before I'm married because that's the way, that's the way it goes. You shouldn't have sex before you're married, then you won't get AIDS.
I'm not even going with anybody. I wouldn't even want to sleep with anybody. I'm just afraid to get it. I mean, I got a young life and I want to live it.
The state mandates family life classes, but not AIDS education.
I do think that it is urgent that every child in the state learn about AIDS. But when I hear of schools in which there is no AIDS education going on at all, I get very, very worried, and I hope that this situation will change rapidly.
While some New Jersey students are learning about AIDS, Tony Lopalato is reminded by an alarm that he is living with it. Every 4 hours, he takes the only approved drug to fight AIDS, AZT.
I don't feel that life has been unjust. I just wish that there was something I could do to sort of stall off the inevitable a little bit.
New Jersey pharmaceutical manufacturers are on the front lines of trying to find other chemical weapons in the war against AIDS.
But the important thing to remember is we probably will never see a cure for the virus infection. The AIDS virus, when it infects human cells and human body, it goes into hiding in the chromosomes of cells and is probably there for the lifetime of the individual who's infected.
The pharmaceutical industry in New Jersey is spending hundreds of millions of dollars on AIDS research. Right now, one of the key goals is to find a drug that will suppress the AIDS virus to allow people to live a normal life.
That's what our goal is. We'd like to suppress the virus to the point where there's no sign of the virus, no sign of disease of any kind. That's as far as we can go towards a cure.
But until that goal is reached, People like Tony live on hope.
I'm not ready to die. There's not enough, I haven't had enough time. I've had a very nice life, I must say. I think I've had a pretty full life. But there are still a lot of things I would like to do.
The pharmaceutical manufacturers say their intensified research will likely lead to the development of new anti-AIDS drugs every 2 years. But until a vaccine or suppressant is found, more people will become sick and die. If you or someone you love has AIDS, there are 2 numbers you can call for help. One is the New Jersey AIDS hotline at 1-800-624-2377. That's 1-800-624-2377. The other is the Hyacinth Foundation in New Brunswick. Their number is 1-800-433-0254. 1-800-433-0254. There are people standing by who can help those who are living with AIDS.
Larry, I think we've all been touched by your series. What's the impact been? What sort of response have you received?
I called the AIDS hotline today, and they told me that approximately they had around 60 calls in response to this series. And tonight at 8:30, just to remind our viewers, we will be having a special half-hour documentary, Living with AIDS, which has a lot of information that I couldn't even fit into the series this week.
Well, Larry, this has been a very informative series. Thank you.
Thank you.
Two-year-old Cynthia has lived with AIDS every day of her short life. 30-year-old Jennifer was told 4 months ago that she tested positive for carrying the AIDS virus. 39-year-old Tony Lopalato was told last year that he has AIDS, and he has been hospitalized 3 times. AIDS has already killed Tony's lover, and it has put a lot of stress on his family. And these 2 men are part of the single largest group of people with AIDS in New Jersey, IV drug users. New Jersey has the 5th largest AIDS population in the country. Since 1981, just over 2,500 men, women, and children have contracted AIDS. 62% of them have died. But as we will hear in the next half hour, the number of AIDS cases will soon reach over 10,000, and the medical bill alone will be staggering. Who will pay this bill? What will we tell our youngsters about AIDS? And how will we treat those who have AIDS while science looks for ways to stop it? These are all questions that face New Jersey and the rest of the nation as we become a society that is living with AIDS. It is on streets and in abandoned buildings like this one in Jersey City where most of the state's AIDS cases start.
This bitch, she don't want to act right here.
People who shoot heroin or other drugs make up nearly half of the 2,500 adults and adolescents in the state who have come down with AIDS since 1981.
The holes that I go through, it's unbelievable.
For the last 3 years, Ron Austin of Spectrum Healthcare in Jersey City has gone into the shooting galleries of Hudson County. A former drug user, he has already convinced around 400 abusers to come in for help. He also tells them not to share their needles and to clean them in a mixture of water and bleach to try to kill the AIDS virus.
I mean, things like not to touch the bottom with the spike, you know, because you might scratch off some germs or something.
Austin says there is an AIDS awareness in the shooting galleries, and it has given addicts an incentive to try to clean up their lives.
They looking at all these people that they used to, that peer group that they used to be involved with, who was shooting drugs with them and they died. You know what I mean? All these people, I mean, a lot of people died in this area.
More will also likely die as a result of AIDS. Many of New Jersey's addicts are carrying the virus and don't know it. That's because the human immunodeficiency virus can stay in the body for months or years before attacking the immune system. Based on the known number of cases and virus carriers today, the health department predicts there will be over 10,000 New Jerseyans with AIDS in 1991.
That's probably about 1 out of every 75 people in New Jersey. And that is assuming there's no more transmission tomorrow. Just with that number of people infected, we will have 1 new case of AIDS every 3 hours in 1991.
You know, I'll give you my word, just come down here tomorrow morning, that's all.
Austin says the day after we took these pictures, both of these men entered a drug treatment program.
Every person that I feel that I can get into some kind of program and get them off this drug or prevent them from catching this particular virus and so forth, I did something. I feel good about it. That's the main thing, that you know that there's somebody out there that you can help.
30-year-old Jennifer, which is not her real name, was in the process of getting help for her heroin addiction when she was told she tested positive for carrying the AIDS virus.
It was impending doom. I thought I was going to die and die in that place I was in. and I had feelings of complete despair, you know. At least I was in the right place, though. I had a lot of counselors, a lot of support around me, and I was able to deal with my feelings of grief.
Jennifer credits her continued counseling for her improved outlook on life.
I can just see where I was and where I'm going. It's real good for me to have the therapy, and I suggest anybody who tests positive go for therapy.
But since being a carrier means she can transmit the virus, Jennifer has some tough decisions to make about her boyfriend and having children.
I really do love him dearly, and I would rather him be free and happy than with me and get sick. So if he's willing to stay with me and we take precautions and be, you know, happy each way we can with each other, then that's important too, if he's willing to do that. And I can't have children. That upsets me a lot. I can't have any children right now. Right now. Today I can't. Not that that's what I had planned on doing, but I'm 30 years old now, and I would really like to have children someday.
Jennifer tested HIV positive while in a drug rehabilitation clinic. The health department believes that there are certain high-risk behavior groups who should be tested for AIDS.
What that means is anyone who has injected drugs into themselves in the past, anyone who has had sexual intercourse with someone where it was not a monogamous relationship over at least the last 5 or 6 years, anyone who received a multiple blood transfusions before March of 1985. And we also add another category. We say people who are what we call the worried well. In other words, there are some people who are so worried about AIDS that they want the reassurance of just going and having the test to know that they're okay. So if they really feel impelled to do it, they should do it too.
Dr. Coy suggests using a personal physician or going to one of 4 health department recommended hospitals or clinics in the state that test for AIDS rather than go to a private company.
If you go to your private doctor or to one of our testing sites and the results are that you're positive, that you actually have the virus, you need a lot of counseling and a lot of help. And it makes me very sad to think of someone sitting alone at home and receiving a letter saying that they're positive for the AIDS virus, and they perhaps don't really understand what that means or how they should protect themselves or their family. What should they do? That's the kind of situation that I'm worried about.
The Center for Disease Control now believes that AIDS will not spread as rapidly in the heterosexual population as other high-risk groups. But that is no reason not to be cautious.
When you sleep with someone, you're sleeping with everybody they ever slept with before, and you're also sleeping with everyone that they shot up with, that they injected drugs and shared a needle with in the past.
Is there really such a thing as safe sex?
There is safe sex if it is sex with a monogamous partner that you have had that relationship with since before the AIDS virus began to circulate in the United States. Once you've defined that as safe sex, then there is safer sex. It is safer to use a condom than not to use a condom with someone whose background you're not sure about. That is not, I think, safe sex. That's only somewhat safer sex.